Hello and welcome to this course on dealing with stress. Stress is a common experience, but it's not always easy to know when it's become more than just a part of everyday life. While feeling stressed from time to time is normal, chronic or severe stress can have a significant impact on your health and well-being. Diagnosing stress involves understanding how it's affecting you, recognizing its symptoms, and seeking appropriate help if needed. In this chapter, we'll cover the tools and methods used to assess stress, both for self-assessment and in professional settings. Stress doesn't have a simple diagnostic test like a blood test or scan. Instead, it's assessed based on symptoms and the impact it has on your physical and mental health. Stress assessments are designed to evaluate the frequency, intensity, and duration of your stress. These assessments help determine whether the stress you're experiencing is within a manageable range or if it's become severe enough to require intervention. There are several methods to assess stress, including questionnaires, interviews, and self-reports. They aim to identify common signs of stress, such as emotional symptoms, e.g. irritability, anxiety, sadness, physical symptoms, e.g. headaches, tension, fatigue, behavioral symptoms, e.g. changes in sleep or eating habits, cognitive symptoms, e.g. difficulty concentrating, constant worrying. The goal of stress diagnosis is to pinpoint how much stress is affecting your daily life and whether it's causing or worsening other health problems, such as anxiety, depression, or cardiovascular issues. Before seeing a healthcare professional, many people use self-assessment tools to get an idea of how stressed they might be. These tools are often easy to access online or through apps, and they provide a quick way to evaluate your stress levels. Self-assessment tools can help you reflect on how stress is impacting you, but it's important to remember that they aren't a substitute for professional evaluation. Number 1. Perceived Stress Scale, PSS. One of the most widely used self-assessment tools is the Perceived Stress Scale, PSS. It's a simple questionnaire that asks you to reflect on your feelings and thoughts over the past month. Questions focus on how often you've felt overwhelmed, unable to control important things in life, or nervous and stressed. The PSS is a useful tool to get a snapshot of your overall stress level. Number 2. Stress Symptom Checklists. Many stress self-assessment tools are simple symptom checklists where you indicate how frequently you've experienced certain signs of stress. These might include physical symptoms, headaches, fatigue, emotional symptoms, irritability, sadness, and behavioral symptoms, poor sleep, changes in appetite. 3. Mindfulness-based stress assessment tools. Some self-assessment tools focus on the mindfulness approach to stress. These tools ask questions about how aware you are of stress and how much control you feel over it. They're useful for identifying whether you're able to manage stress through awareness and present moment focus. While self-assessments can give you a sense of your stress level, it's important to seek professional help if stress is severely affecting your daily life. Professional evaluations offer a deeper and more accurate understanding of how stress is impacting your health and well-being. Mental health professionals, such as psychologists, counselors, or primary care doctors, use various diagnostic tools to evaluate stress more thoroughly. 1. Clinical interviews. When you meet with a healthcare provider, they will often start by conducting a clinical interview. This involves asking questions about your lifestyle, stressors, mental health history, and how you're feeling. The interview helps the professional get a better understanding of what's causing your stress and how it's affecting you. 2. Psychological testing. Mental health professionals may use standardized psychological tests to assess your stress level. These tests can measure your emotional state, cognitive functioning, and physical symptoms. Some tests are designed specifically to assess stress, while others evaluate for related conditions like anxiety or depression. 3. Physical exams. Stress can cause or exacerbate physical symptoms like headaches, high blood pressure, and digestive issues. For this reason, your doctor may conduct a physical exam to rule out other potential causes of your symptoms. They may also ask about your sleep, appetite, and energy levels to assess how stress is affecting your body. When to seek help for stress. It can be difficult to know when stress has become something you need professional help for. After all, stress is a part of life, and everyone experiences it at some point. However, if stress starts to interfere with your ability to function in daily life, it's time to consider seeking help. Some signs that it may be time to see a professional include stress is leading to physical health problems, e.g., high blood pressure, frequent illness. You're experiencing severe anxiety, depression, or panic attacks. Stress is affecting your ability to work, maintain relationships, or take care of yourself. You're using unhealthy coping mechanisms like excessive alcohol or drug use to manage stress. In some cases, chronic stress can lead to burnout, a state of emotional, physical, and mental exhaustion caused by prolonged stress. If you're feeling overwhelmed, constantly drained, and disconnected from the things you once enjoyed, burnout might be a factor, and professional help can be crucial in managing and recovering from it. These videos are made possible thanks to our amazing sponsors. Meet anyone for anything on the Introducer app. Whether you're looking for friends, romance, or something in between, Introducer has you covered. Download for free today. Experience a new heaven and a new earth in a virtual paradise and global community. Church has never looked like this. Your contribution can bring Earth 2.0 to life. Finally, if you'd prefer to watch these videos without ads, visit our Mental Wellness Hub on the Happy app. Click the links in the description. Finally, although this course was free for you, it was not free to get it to you. Please consider giving a small donation to help spread these courses around the world to those most in need. The link is in the description. See you in the next lesson.